Good morning once again, ladies and gentlemen. Let's please be upstanding for the procession of council members and invited guests. You may kindly resume your seats. Thank you. We will invite Dr. Na Okaiko Addison for the opening prayer.
Shall we please rise for the opening prayer? Our Father and our God, we thank you for granting us life, for granting us good health, and for bringing each one of us here safely this morning. We thank you for all you are doing in our individual lives and in our respective families. This year has been a rather difficult one in various regards, but we thank you, Lord, for how far you've brought each one of us. We thank you for the Ghana College of Physicians and Surgeons and for all its accomplishments in the past year. We thank you for the residents whom you've taken through various periods of training successfully and are being inducted this morning. We pray committing this induction ceremony into your hands, that Lord, you be in absolute control and you bring it to the expected end. In Jesus' name have we prayed with thanksgiving. Amen. Please be seated.
Thank you very much, Dr. Addison. The presence of the Lord is with us. We will sing the song of praise and prayer. The choir just give us a rehearsal of that song. Kindly be upstanding as the choir leads us through the song. Thank you. So we will sing along with the choir. Can we please be upstanding? Thank you very much, Kwa, and thank you very much, everyone. Kindly take your seats. You will not stand for so a long time to come. All right, so you are all welcome to the induction ceremony of the Ghana College of Physicians and Surgeons at the 19th Annual General and Scientific Meeting. This is where we admit our new members and fellows, and you are all very welcome. We have a few dignitaries in our midst. I will quickly go through the list in no particular order of importance. Our guest speaker will be joining us very soon, but we have the council chairman with us, Professor Yao Edujemfi. All council members are here with us. The rector of the Ghana College of Physicians and Surgeons, Professor Richard Dadanu, is in our midst. The president, Dr. Nkrumah Mills, is with us. Vice rector, Dr. Henry Lawson, is with us. We have the vice president of the Division of Surgeons, Professor Samuel Debra. Vice president, Division of Physicians, Dr. Audrey Forson, both here with us. We also have reps from sister colleges. We have Professor Durudami Lisik from the West African College of Physicians, and we also have Professor Grace Parkins from the West African College of Surgeons coming to share fraternal messages with us. In our midst is also the Deputy Minister of Health, the Honorable Alhaji Mahama Asei Seini, and we also have our former rector, Professor David Oforiaji, with us. And I am told that we have an Honorable Minister, Cletus Avoka, former MP Cletus Avoka in our midst. Please, if you are in the stands, can we see a wave? Current MP, Cletus Avoka. Yes, there he is, to support one of our own. So, again, we also have our own fellows and members in the midst, and we have those of us who are being inducted this morning. Kindly clap for ourselves and our supporting families who are here with us. So you are all very welcome, and we are expecting to have a very beautiful morning as we go through the program. I will call on the chairman of council, Professor Yao Edujemfi, to do the opening of the induction ceremony. Let's welcome him with a hand clap.
Good morning. No speeches. I, Professor Yao Edujemfi, by virtue of the authority vested in me as chairman of the Council of the Ghana College of Physicians and Surgeons, declare this assembly opened for the purpose of admission of fellows and members to the Ghana College of Physicians and Surgeons. I'm done.
Thank you very much, Council Chair. No speeches. We will now call on Dr. John Nkrumah Mills, President of the College, to give us the welcome address. Let's welcome him again with another round of applause.
Chairman of Council, Professor Yao Edujemfi, and all council members here present. I'm addressing also our guest speaker who is supposed to be on her way. Our Honorable Minister of Health, who is ably represented by the Deputy Minister of Health, Alhaji Seini. The college lecturer is also absent, and I'm addressing him also. Representatives of sister colleges, distinguished invited guests, members of the press, and fellow members of the Ghana College of the Physicians and Surgeons. I'd want to welcome you all to the opening and induction ceremony of this, our 19th Annual General and Scientific Meeting. This year's Annual General and Scientific Meeting is different from the ones we've had previously, in that we are having the induction and opening ceremony done twice in the same year, in the same day. First in the morning and again in the afternoon. Yes, the ceremony is impressive as well as a happy occasion. However, it is not for either of those reasons that we are holding the ceremony twice today. But as the poet Robert Burns put it, the best laid plans of mice and men often go awry. The Act of Parliament, which set up the Ghana College of Physicians and Surgeons, did not put a limit on how many specialist doctors the college has to train each year. And the college, estimating the needs of the nation for specialist doctors without a change in our excellent infrastructure, has activated a strategic plan to meet this need. The result is that for the past 2 years, the numbers of specialists passing out of our training programs yearly has exceeded the numbers that can be conveniently crammed in one ceremony. So we must have to. We must adapt to our new circumstances, and you are part of our happy history today. As we sang, there are great personalities, great people who planned this college. I'd want to applaud them and applaud also those who have been involved in implementing the programs and the successful running of the college. These include the rector and his administrative staff, our indefatigable faculty officers and trainers, both local and those in the diaspora and Ghanaian Doctors Associations, the various hospitals where our residents train, our collaborators, especially sister postgraduate medical colleges, both in Africa, in the UK, and other continents, including those who act as external examiners to ensure the high standard in our examinations. There are also those in industry, finance, and great-spirited individuals within civil society who support our endeavor as a college. We are grateful to them all. Of course, the Ghana government and the Ministry of Health have been our main sponsors, and we are indeed appreciative. The college, following its strategic plan, continues with more facilities being accredited as training centers and sites once the infrastructure and personnel satisfying the required standards are in place. Mr. Chairman, we may need to add advocacy to our efforts. Advocacy to ensure more facilities meet the required standards for training, and also that equipment for the highly trained consultants we are producing are in place for them to deliver service to the population. To the college, quality assurance in the training process and examination is key. The academic board has instituted training programs for our trainers and systems for improved assessment of the training methodology itself and the performance of the residents whilst in training. When the rector gives his reports on the college activities, you'll appreciate what has been achieved and anticipate the great things that are yet ahead of us. Our guest speaker from one of the countries where we have a lot of collaboration and cooperation, for which we are grateful, Her Excellency, the British High Commissioner to Ghana, will share some thoughts with us. Our sector minister, ably represented by the Deputy Minister, Alhaji Seni, is also with us, and I'm sure will advise us as we endeavor to fit into the expanded national aspiration of equitable universal health coverage for the country, even in the face of a challenging global economy. Ladies and gentlemen, you soon witness the highlight of this occasion, the unique and sacred ceremony of admission of new members and fellows into the Ghana College of Physicians and Surgeons, and of their making their solemn pledges to the college and to humanity. No, they don't need to take the Hippocratic Oath again. As in my opinion, one should not be asked to take that heavy solemn oath twice in his or her lifetime. However, I'd want to remind these colleagues of one of the vows in the Hippocratic Oath that they seem easily to forget about fulfilling. And as they take the new oath, they should make it a point to fulfill them. And that oath reads, "To hold my teacher in this art equal to my own parents." Actually, I've got a hold of the old Greek documents with certified English translation. So this is from the oath. I'll take it again. "To hold my teacher in this art equal to my own parents, to make him a partner in my livelihood. When he is in need of money, to share mine with him. Your teachers haven't complained. But I'm just reminding you that this is in the original oath from the pen of Hippocrates himself. In these times of challenging global economy, please do the decent thing. Happen to be one of the teachers. We shall also honor one of our collaborators in specialist training in surgery, a person whom the council of the college deems deserves the honor of a fellowship of this college on account of its outstanding voluntary efforts in training our residents over several years. This year also we have Professor Peter Donko, and he will be our college lecturer. He will be speaking on treating the child with facial difference. Does the state have a role? This will be online, and you will find the link to that lecture. That will be 10 o'clock tomorrow. We invite all of you to participate. Mr. Chairman, distinguished invited guests, distinguished ladies and gentlemen, I welcome you all to this memorable function of the Ghana College of Physicians and Surgeons. And thank you all very much for coming. Akwaba.
Please, you can do that a little better. Thank you very much, President of the College. It's time to call on our friends and sister colleges to share fraternal messages with us. And we will first invite Professor Durudami Lisk from the West African College of Physicians. Let's welcome him with a round of applause.
Mr. Chairman of Council, I wish I could follow your example and just say no speech, but I'm not sure I'll be allowed to. President, fellows and members of the Ghana College of Physicians and Surgeons, I bring to you greetings and goodwill from the West African College of Physicians on this your 19th Annual General and Scientific Meeting. The West African College of Physicians appreciate the participation of the Ghana College in our recent 46th Annual General and Scientific Meeting. And unlike last year, I feel the need to be here in person to show solidarity with your college. Both colleges are on a similar journey and face the same impediments, the same frustrations, the same financial shortcomings, and the same uphill struggle with bureaucracy. These past couple of years have been truly challenging, firstly with the COVID pandemic, and more recently the Ukraine war. Even the rich and powerful countries with well-resourced health systems cowered and still cowering under the strain. In the NHS in England, waiting lists for surgery and cancers are at an all-time high. The number of people waiting over 12 hours in accident and emergency has broken all records. In Sierra Leone, we have a proverb which says, if a storm can bring down a concrete house, what will it not do to the tail of a chicken? So we, the chickens in this part of the world, have to find a way to survive the storm. The theme of your conference, maintenance of health in a challenging global economy, policy and practice implications, is timely. The choice of the word maintenance rather than improvement, I believe, is deliberate. Realistically, we have first to maintain what we have before taking the next step to improve. We have to look at facilities, utilities, and manpower. As far as facilities are concerned, we are all too familiar with the crumbling hospital buildings with poor water and electrical supply. Yes, yet vast sums of money will be spent building a new brand facility which will be under-equipped, understaffed, and underused. We then look at what I term utilities. These are what we require to deliver health care. These range from blood pressure machines to MRI scanners. Since hardly any of these are made locally, the cost and foreign exchange availability and deteriorating exchange rates present a massive challenge to maintaining health in the sub-region. Finally, the vexed question of manpower. As the global economy impacts negatively on our fragile economies, our workforce, which includes nurses, laboratory technologists, radiographers, as well as doctors, are finding it difficult to maintain their standard of living. This push factor, coupled with the pull factor from richer countries, make it increasingly difficult for our young professionals to resist practicing their trade abroad. In spite of all this, the duty of our colleges is to provide solutions to these challenges, and discussing them today is a start. We must make the best of what we have. Let's capitulate. Let's capitalize, not capitulate. Those receiving their memberships and fellowships today, I congratulate you and urge you to uphold the traditions of your revered college. You are the future of this august institution. Chairman of Council, President, and Fellows of the Ghana College, on behalf of the West African College of Physicians, I once more wish you a successful and memorable meeting. I thank you.
Thank you very much, Professor Lisk. We will call on Professor Grace Parkins for the fraternal message from the West African College of Surgeons. Please welcome her with a round of applause.
I, as a treasurer of the West African College of Surgeons, stand on behalf of the president, who is on a different assignment. Honorable representative of the Minister of Health, President of the Ghana College of Physicians and Surgeons, Chairman and members of Council, Rector, distinguished invited guests, please permit me to stand on the existing protocol. On behalf of the fellows, members and diplomats of the West African College of Surgeons, I bring you warm greetings on the occasion of the AGSM of the Ghana College of Physicians and Surgeons. We are very proud of our association with this college and the very close collaboration we have enjoyed over the years. We look forward to the further strengthening of this relationship in order for it to benefit the people of Ghana and the sub-region. The theme you have chosen for the AGSM, maintenance of health in a challenging global economy, policy and practice implications, throws the, sorry, I'm just reading what it's giving me, throws the spotlight on the relationship between health and the economic well-being of a nation. The importance of our economic circumstances in influencing the choices we make regarding health manpower training, infrastructure expansion, and funding of health services is undeniable. Yet, we also know that healthcare cannot be made available only to the economically well-off. Health is essential for economic productivity. For this reason, our political and economic leaders must take a broader and long-term view of development and invest in the health of the population for sustainable development of our countries. No expense should be spared in strengthening our health systems. We must get ourselves invited to the discussion table and not wait to complain after unfavorable policies on health are handed down by the economic gurus. As health leaders, we must remain wholeheartedly committed to the sustainable development goal of achieving universal health coverage for all, including financial risk protection, access to quality care, and safe and affordable medicines and vaccines. The gross inequities in access to health services within the general population and among the different socioeconomic groups in our individual countries is unacceptable and need to be addressed. Specifically, we need qualified specialists in every corner of the country. District hospitals must be upgraded and well-equipped to provide some specialist services and be suitable for postgraduate training and out-of-pocket payment for services, and drugs must belong to history. Just a moment, I'll take that again. And out-of-pocket payment for services and drugs must belong to history. If we prioritize health, we will not see this as a pipe dream. I wish to assure you of the wholehearted support of the West African College of Surgeons with any strategies you may come up with as you deliberate on the theme of the conference. I wish you successful deliberation and scientific sessions. I wish also to congratulate the new members and fellows. I know you've worked hard to get to this point, and I wish you all the best in all that lies ahead of you. This is a springboard, it's just the beginning to greater heights. Long live Ghana College of Physicians and Surgeons, long live Ghana, long live ECOWAS, long live the West African College of Surgeons. Thank you.
Thank you very much, Professor Parkins. We have also been joined by a former president of the college, Professor Lassie, and we also have the Deputy Attorney General and Minister of Justice, the Honorable Dinah Asuba Dapa, in our midst. The choir will give us 10 minutes of a musical interlude, and then we will have the address of the rector. So let's enjoy the choir.
wondrous glory, rises morning Bethlehem. Glory in the highest glory, peace on earth, goodwill to men. Listen to the wondrous glory, rises morning Bethlehem. Glory in the highest glory, peace on earth, goodwill to
Thank you very much, MOH Choir. Please give them a round of applause. We want to specially welcome our guest speaker for the day, Ms. Harriet Thompson, the British High Commissioner to Ghana, and she has just joined us. Let's welcome her with a round of applause as the rector comes to give his speech. Thank you.
Good morning to all of you, and welcome to this graduation and induction ceremony of the Ghana College of Physicians and Surgeons. Honorable Deputy Minister of Health, representing our Honorable Minister of Health, Chairman of the Council of Ghana College of Physicians and Surgeons, members of the College Council, President, Ghana College of Physicians and Surgeons, Vice Presidents of the College, Vice Rector, distinguished guest speaker, faculty chairs and secretaries, other officers of the college, past presidents of the college, past rectors, representatives of sister colleges, invited guests, graduating doctors, our friends from the media, ladies and gentlemen. On behalf of the management of Ghana College of Physicians and Surgeons, I welcome you all to our 19th Annual General and Scientific Meeting, and specifically to this ceremony for the admission of newly qualified members and fellows. At this year's ceremony, we are highlighting existing partnerships and future partnerships for postgraduate training, and this is shown in our selection of guest speakers for our two ceremonies. This morning's ceremony will have the British High Commissioner as our guest speaker. The British government has been supporting residency training in Ghana through a partnership with the Tropical Health Education Trust, and this has resulted in remarkable achievements in the faculties of anesthesia, emergency medicine, laboratory medicine, and psychiatry. The Bank of Ghana recently opened the ultramodern Bank Hospital, and they have already started having discussions with us about how to position this hospital as a training facility. In anticipation of this future partnership, we have the Governor of the Bank of Ghana as our guest speaker for the afternoon session. This year, we'll be inducting a total of 294 members and fellows. We'll be inducting 212 new members and 40 new fellows who have completed their training and passed the required examinations. We'll also be inducting 42 new fellows who have been elected by different faculties to be fellows based on their qualifications, scholarship, and contribution to training of postgraduate doctors. I take this opportunity to congratulate our new members and fellows for this achievement. The government of Ghana has made a commitment to fund the postgraduate training of doctors and has continued to echo this commitment even in the face of the current economic challenges. These economic challenges have had the effect on the speed with which our college receives funding from government. However, the good news is that I received firm assurance just yesterday that we'll be receiving a significant proportion of the funds we need before the end of the year, while the Ministry of Health works to ensure that we receive the resultant outstanding amount early next year. We would like to express our gratitude to the Government of Ghana and the Ministry of Health for this continued support. I'm really happy you clapped spontaneously, otherwise the money would not come. The management and council of Ghana College of Physicians and Surgeons always have our eyes on the health human resource needs of the country so that we can make meaningful contributions. One of these needs is for middle-level doctors who can provide anesthesia services, especially in our regional and district hospitals. In the past year, we have started a modular training program for a diploma in anesthesia, and the first batch of a little over 20 trainees will be completing their training in the next few months. One remarkable aspect of this program is that these trainees are able to provide anesthesia services while going through their training, because they are based in their hospitals for the period of training and only leave their duty posts for short periods to go through formal group training. We also integrated the Faculty of Orthopedic and Trauma Surgery about a year ago, and this new faculty has successfully conducted primary examinations and admitted their first batch of trainees for a straight 5-year fellowship training in orthopedic and trauma surgery. We are working to set up similar programs in other surgical subspecialties, such as neurosurgery, urology, cardiothoracic surgery, and plastic surgery, to address the human resource needs that exist in these fields. A continuing health human resource challenge is the low percentage of doctors who pursue postgraduate training up to the fellowship level. Fellowship training is the peak of medical postgraduate training. The additional years of fellowship training increase one's theoretical and practical knowledge in the specialty area, and these make a person more competent in managing health problems and their related complications. Fellows are also the ones who lead the training in medical schools and who are responsible for providing postgraduate medical training. If we think of our national needs, then we can say that every Ghanaian deserves to be cared for by doctors who have achieved the highest level of qualification, and these are fellows. Fellows are not only needed in teaching hospitals, but also in regional and district hospitals to ensure high quality of care. If national needs will not encourage majority of our graduating members or doctors who are intending to come into training to pursue fellowship training, then I'll try to appeal to selfish motives. Ghana Tertiary Education Commission, our universities, and our college are not going to lower the standards of entry for people who lead undergraduate and postgraduate medical training. Those who do this will always be fellows. The rising population and healthcare needs are also going to lead to an increase in medical schools in the years ahead. So if an overwhelming majority of our members do not take up fellowship training, these medical schools might end up being staffed and led by non-Ghanaians who have a fellowship qualification. You see, at this point, you might be wondering, where is this man's rambling going? You see, if this scenario happens, and your child happens to get a borderline pass for entry into medical school, and you discover that you do not have any schoolmates in medical school leadership that you can have that kind of conversation with, then it will dawn on you that this man was not just rambling that day. I'm aware of the minimal salary jump that exists between the specialist and senior specialist grades, as well as certain developments that might make it appear not too attractive to pursue the additional fellowship training. And I would like to assure you that we are having conversations at the policy level to address these things. But I would also like to urge you to make every effort to pursue fellowship training while we also work hard to address the issues that might make pursuing this training not so attractive. One thing that we are doing to bring fellowship training closer to our members is that we are working on developing fellowship training programs that would be primarily housed in regional hospitals. The college has signed an MOU with Ghana Health Service and is in the process of completing an MOU with the Christian Health Association of Ghana, while our various faculty boards are working on the format of the programs. The chief executive officers of our teaching hospitals are also fully in support of us running fellowship programs based in regional hospitals, and they are willing to support the movement of staff from their hospitals to provide support for the training in the regional hospitals until we have fellows who are based in those hospitals to provide that training. So many people are behind this, getting the fellowship training closer to our members. And such programs, when launched, hopefully next year, would get the first few started. Fellowship trainees for the general specialty areas can have their training in the regions where they practice and still provide service to their parent hospitals as part of the training. In such cases, there will be no need for a study leave or a gap between membership qualification and the start of fellowship training. I hope that many of our members, those graduating today and those who've already graduated, will take advantage of this when this training opportunity opens up. One of the mandates of our college is the promotion of research in medicine and surgery. One way in which we have worked at achieving this mandate is to have a mandatory research project requirement for graduation as a fellow of the college. Conducting research and publishing research findings should not be seen as a role that should be fulfilled only by the small percentage of doctors who are employed by universities and research centers. The truth is that practicing doctors encounter large amounts of data in their everyday work. And it is our wish that more of these doctors would conduct research, attract research grants, and publish their research findings in reputable journals. To facilitate this, we are working on setting up the appropriate research administration infrastructure within the college to assist members and fellows in the conduct of research. The college is currently registered with the European Union Research Grant System and the National Institute of Health and Care Research of the United Kingdom. And we can help members and fellows work on grant applications to these and other research grant institutions while managing the grants at the college. I would like to encourage members and fellows to see our college as a home for their research projects. As we slowly grow the volume of research projects housed in the college, we can get more of our trainees doing their fellowship research projects within the context of an existing funded research. And that would definitely increase the quality of research output of our fellowship trainees. At this point, I would like to applaud the efforts of Professor Irina Jipong of the Faculty of Public Health, who led a consortium of African countries to win a £10 million research grant for research into non-communicable diseases from the NIHR of the United Kingdom. Prior to this, she also had an adolescent health project funded by the Medical Research Council of the United Kingdom. I cannot talk about research projects in the college without mentioning Dr. Wilfred Labiado of the Faculty of Orthopedic and Trauma Surgery, who has secured research and training grants from AO Alliance, and Dr. Erasmus Agongo, who has secured grants from the World Health Organization and also from Medical Research Council UK, together with collaborators from University of York. Ghana College of Physicians and Surgeons is also part of a consortium of 14 research institutions that has been awarded a €4.2 million grant for adolescent health from the European Union that would start next year. All these grants are managed at our college, and we would like to see an increase in the number of research grants in the coming years. To ensure that our trainees get the needed theoretical foundation for research, we have developed a modular basic research course for the membership level, which will start in February 2023, and an advanced research methods course for the fellowship level, which will start in June 2023. A course on systematic review and meta-analysis was launched last month for fellowship trainees in partnership with trainers from University of Amsterdam. These courses will be run through the year and will be mandatory requirements for qualification to take the final examinations. I'm happy to announce that we completed work on the electronic logbook ePort, which would be used for tracking the training activities of residents as well as for part of their continuous assessment. A pilot test of the ePort is currently being run at Kolibu and Komfanochi teaching hospitals with selected trainees and trainers from all our faculties. We expect to roll out the ePort to all trainees within the first quarter of 2023 and slowly phase out the paper-based logbook system. We successfully held our membership and fellowship exams in March and September of this year, We had a total of 1,099 candidates sitting for the examinations and 850 passing, giving an overall pass rate of 77%. The pass rates, so these are the graduates applauding for themselves. I think you could applaud for yourselves louder than that, can't you? The pass rates were 75% at the primary level, 81% at the membership level, and 82% at the fellowship level. Finally, I want to commend the Office of the Honorable Minister of Health for supporting us to get cabinet approval for our proposed guidelines for postgraduate medical training. The implementation of these guidelines would lead to some good changes in admission into postgraduate training. And these changes include the following. Candidates applying for selected specialties will be able to enter residency training right after their house officer rotations. And these selected specialties that the candidates can enter into directly will be run as straight fellowship training programs. The selected specialties are anesthesia, dental surgery, emergency medicine, laboratory medicine, ophthalmology, otorhinolaryngology, psychiatry, radiology, oncology, and radiotherapy. So tell your friends and family who are in medical school that this is where to go to. They'll get in straight. Outstanding graduates from all medical schools in the country, both public and private, will be allowed to enter the residency training program of their choice right after their house officer rotations. Candidates who excel at the membership examination for programs that are not designed as straight fellowship training programs will be recommended to proceed immediately with fellowship training. We are going to start implementing all these changes with our next cycle of residency admissions. And one of the implications of the implementation is that we are going to have multiple entry interviews so that people don't have to wait for so long before they get into the program. In conclusion, this has been a busy but satisfying year, and this has been due to our collective efforts. I would like to end by thanking the Honorable Minister and the Ministry of Health, our Governing Council, all our valued stakeholders and partners, members and fellows of the College, and the staff of the College administration for their contribution to a successful year. Long live Ghana College of Physicians and Surgeons. Long live Ghana. Thank you.
Thank you very much, Rector. I counted 10 claps interrupting the speech. That means a lot of good news for us. Is that not so? Yes. And I'm sure the Deputy Minister of Health will even bring better news. So we welcome the Deputy Minister of Health, Honorable Alhaji Mahama Seni, to give us the speech.
Good morning once again. Today is the day the Lord has made for us, so clap hands for yourselves. I must say the government of Ghana is proud of you. Ministry of Health is proud of you, and I join your families to congratulate you for today. I'm so happy. And your Rita has also up for the Minister of Health. Just be clapping as I'm reading. Chairman of the Council of Ghana College of Physicians and Surgeons, members of the College Council, President of Ghana College of Physicians and Surgeons, Vice President of Ghana College of Physicians and Surgeons, Rector, Vice Rector, Guest Speaker, faculty chairs and secretaries, other officers of the college, past president of the college, past rectors of the college, representatives of sister colleges, invited guests, graduating doctors, friends from the media. Try to capture this occasion properly. Ladies and gentlemen, we have once again come to the end of another academic year of the Ghana College of Physicians and Surgeons, and we are happy to be here to witness the graduation of 294 daughters, which will result in 212 additional members of college and 82 additional fellows. The Ministry of Health continues to be proud of the contribution that Ghana College of Physicians and Surgeons is making to health service delivery and health policy in the country. Many of your members and fellows serve on important committees of the Ministry of Health and Ghana Health Service, in addition to providing critical potential care in many parts of the country, or specialist care in many parts of the country. The current economic challenges in the country have had an effect on government remuneration of your college for postgraduate medical training or for medical training. The ministry is aware of these challenges and is working closely with the management of the college to ensure that some significant payment is made before the end of this financial year. So you can be assured we supporting you. I would like to take this opportunity to congratulate the college on achievement not directly related to postgraduate medical training. The Ministry of Health was closely involved in the launch of the National Institute of Health and Care Research UK grant to the college for research into non-communicable diseases. This grant of £10 million over 5 years was made to a consortium of African countries led by Professor Irene Japon of this college. Clap for our prof. The involvement of Ghana College of Physicians and Surgeons in the multidisciplinary and multi-institutional research is highly commendable. It is my hope that this research project will build the capacity of Ghanaian doctors and researchers, in addition to improving the care of Ghana of people suffering from non-communicable diseases. The ministry will also like to see an increase in the number of funded research projects that the college is able to attract. As part of the annual General Scientific Meeting activities, I am informed that the college organized its members and fellows to provide healthcare services at Bojuasi Polytechnic, a polyclinic, and that this service benefited over 700 people in the community. That is good. The ministry appreciates the college's effort in addressing health service delivery and is happy to partner with the college for more of such activities, which should not just be limited to the week of the AGSM. Last year, the Office of the Honorable Minister of Health started working with the management of Ghana College of Physicians and Surgeons on a policy document that would improve the rate at which the college produces fellows, and that would also reduce the waiting time between the completion of house officers rotations and the start of resident training. I am happy to inform you that this policy document has been approved by Cabinet and will start being implemented with the next intake of trainees. I take this opportunity to commend the management of the college, the academic board, and the college council for all the work done to make this a success. Ghana College of Physicians and Surgeons has done a lot in increasing the number of specialists in Ghana. However, it is clear to us all that the rate of production of members and fellows of the college does not match the growing healthcare needs of the country. I hope you are all aware. So please, when you finish, don't run away from the country. We want you to be here. It is therefore imperative for us to find ways of further increasing our output. Mr. Waiter, are you hearing? We want to increase our output, and you can count on me. The signing of the MOU between the Ghana College of Physicians and Surgeons and Ghana Health Service, which authorizes the college to proactively evaluate regional hospitals and establish training programs, is very welcome. It's very welcome news to the Minister of Health. We hope to see the establishment of new training centers under this initiative within the next year. Our numbers are short. Let's increase the numbers. The college should also make use of information technology to ensure that trainees can receive certain aspects of their training without having to move to the teaching hospitals. Combining this with targeted rotation in teaching hospitals will go a long way to improve training and increase the output of specialists. The new members and fellows who are graduating today have all put in a great deal of work and dealt with the challenges of relocation and other infrastructure and equipment related challenges in trading. You are all here today because you have successfully handled these challenges and come out in flying colors. The Ministry of Health congratulates you for this great achievement. We also recognize the support that has been provided by your families and friends in making this day a reality. While we would like you to enjoy this moment to the fullest, it is important for you to realize that there are many people in the country who are looking up to you for specialized medical and surgical services. I am therefore calling on you all to provide the best service possible to all people who come under your care. It is also important for you to make sure that you keep up with development in your field of practice and provide the necessary technical advice to get our health delivery services to improve. I've talked all about need for an increase in the rate of production of specialists, and I would like all our new graduates or graduates to know that you are all part of the solution to the problem. All of you should aim to become trainers or postgraduate doctors and so do everything that is required for you to be a certified trainer. You will then join forces with those who have trained you to turn out even more specialists for the country. Before I say long live Ghana, I say long live you. If you don't live long, Ghana cannot live. Don't be so. So long live what? The physicians and surgeons of this college. Before Ghana can live. So once you live long, let me then tell Ghana, long live Ghana College of Physicians and Surgeons. Long live our nation, Ghana. Thank you very much. And anytime I meet a group like this, I often ask that question, which is the most important ministry in this country? And in most cases, I ask the question and answer it myself, because I'll never get answers. And some of the answers I get, somebody will say Minister of Finance, somebody will say Food and Agriculture, somebody will say Road. And I answer it by saying that I've never seen a dead person spending money. And I also haven't heard that if the Minister of Finance is sick, he go to lie in Bank of Ghana vote. A word to the wise is in the north. Thank you.
Thank you very much, the Honorable Mahama Asei Seini, for a wonderful speech. He said the rector had said most of the good things he had to share. And so please give him a round of applause for adding a few more to it. Ladies and gentlemen, we are very honored to have in our midst the High Commissioner from the British government to Ghana as our guest speaker for the morning. Ms. Harriet Thompson will be delivering the speech by the guest speaker. Shall we be upstanding as we welcome her with a round of applause? You have been sitting for too long, so welcome her whilst we stand.
Good morning, everybody. I'm very glad that he asked you to stand because it did feel like everybody needed just to reinvigorate themselves a bit. Maybe have a bit of a wiggle before you sit back down again. Honourable Minister of Health, please do sit down again, though, please, sorry. I should have said that. Honourable Minister of Health, very ably represented by the Honourable Deputy Minister, Chairman of the College Council, the Rector and Vice Rector of the College of Physicians and Surgeons, members of the College Council, President and Vice President of the Ghana College of Physicians. My app has just closed. Let me try and reopen it before we lose it all. No, it has indeed just closed. Let me find it again. Halfway through the protocol, I apologize to anyone I haven't recognized yet. Physicians and surgeons, faculty chairs, secretaries, and other officers of the college, past president and past rectors of the college, invited guests, particularly importantly, all of the graduating doctors here today, ladies and gentlemen. I'm really delighted to participate in this 19th General Scientific Meeting of the College of Physicians and Surgeons and to witness the graduating ceremony for all the successful doctors. Huge congratulations on your impressive achievement. All that hard work has paid off. I'm congratulating all of the graduating doctors. I'm congratulating all of the faculty who supported them through this great achievement. And perhaps particularly, I'm congratulating all of the family who are represented here today. It's wonderful to see you after a couple of years of not being able to be present at events like this. And I know that the support you will have provided to your sons, daughters, your relatives to get them through this will have been immense. So congratulations to all of you. I'm particularly happy to be here this morning because, as has already been mentioned, the partnership between the UK and Ghana when it comes to health, and particularly for today when it comes to training in health, is long and it's deep. It's been 2 decades in the making. Key milestones on that journey include Ghana's success in achieving the Millennium Development Target of reducing child deaths by nearly 2/3, enactment of Ghana's 2012 Mental Health Act that supports the establishment of mental health services closer to communities, and Ghana's Food and Drug Authority reaching WHO Maturity Level 3. That's only the second of such authorities in the whole of sub-Saharan Africa to achieve that level. Turning to the present, the COVID-19 pandemic and Russia's invasion of Ukraine have created real hardships economically and have exposed weaknesses in health systems, not only in Ghana but right the way around the world. Yet at the same time, the unprecedented advancements in science and medicine that we've seen, advancements that enabled the rapid production of the tools that we now use to fight COVID-19 successfully, are to be celebrated. Deepening that research expertise and creating the next generation of health, creating a culture in which innovation is encouraged are key to tackling the next generation of health challenges. Ghana has demonstrated remarkable depth in health workforce capacity. This is evidenced by the decisive approach to tackling COVID-19, particularly in the first year of the outbreak, the swift containment of the Marburg disease outbreak, and the health sector's response to the Apiate explosion. Yet the health sector's own assessments suggest that there's much more to do to ensure quality care for all in Ghana. Let me share an uncomfortable reminder, perhaps, that we have just 8 years to reach the Millennium Development Goal on health. Within that context, the UK-Ghana Health Partnership has evolved from an initial focus on delivering health services towards technical assistance to strengthen Ghana's own health system so that it is better placed to do that delivery, to make good use of the available resources, and to achieve universal health coverage. The UK fully supports Ghana's vision for a skilled, equitably distributed health workforce that effectively addresses current health challenges, but is also well positioned to tackle emerging issues and future health threats. Our partnership with the College of Physicians and Surgeons addresses 4 areas, agreed with the College and with the Ministry of Health, to deliver on Ghana's health workforce targets and to position the College as a regional centre for excellence. The first is health workforce governance and leadership. We're working with the WHO and UK institutions to strengthen managerial expertise in health sector leaders, both nationally and regionally. Secondly, we're supporting the strengthening of postgraduate medical training through partnerships between the College of Physicians and Surgeons and 4 UK Royal Colleges in emergency medicines, anaesthesia, pathology and psychiatry. The partnerships between Ghana and our Royal Colleges of Medicine are multifaceted. Direct UK-Ghana exchange of expertise is strengthening training curricula, while the creation of peer support networks, starting with doctors in Ethiopia and Zambia, will encourage African-grown solutions to Africa's medical challenges. Thirdly, we're excited to begin work with the Ministry of Health and UK hospitals to decentralise postgraduate medical education in Ghana by expanding the number of accredited medical teaching sites outside of Accra. The UK will augment existing rural incentive schemes by providing international exchange placement schemes for UK and Ghanaian trainees working in rural locations. And lastly, the UK is deepening research capacity within Ghana's postgraduate medical education training. In October 2022, the UK, as we've already heard, awarded funds to a consortium led by the Ghana College of Physicians and Surgeons and the London School of Hygiene and Tropical Medicine to establish a West Africa Research Centre for Non-Communicable Disease Control. That award is in addition to an existing UK health research portfolio in Ghana of over £9 million, working with academia and teaching hospitals on projects ranging from basic vaccine research through improving surgical practice to climate and health issues. The partnership with the College outlined above complements broad UK support to Ghana through global health initiatives, such as the Global Funds for HIV/AIDS, TB and Malaria, and the Global Vaccine Alliance. So let me end by again congratulating all of the doctors who are graduating here today. Today is the culmination of a period of extremely hard work, as well as being the beginning of a lifetime of hard work. I wish you a successful and rewarding medical service to Ghana. It's both a privilege and a responsibility to provide care when people are at their most vulnerable. Permit me as a layperson to kindly encourage both faculty and doctors to put respectful care at the front and centre of health service delivery. I urge you to serve diligently with respect, compassion and integrity. The difference those behaviours will make not only to your patients but to all of the people around you is enormous. So I ask you to accept the challenge of role modelling those behaviours across the health service and beyond. And finally, to the College of Physicians and Surgeons and to the Ministry of Health, please be assured that the UK remains committed to continuing our health partnership to the mutual benefit of both of our countries. Thank you.
Her Excellency Harriet Thompson, British High Commissioner to Ghana. Please, another round of applause. So very soon we'll be getting to the crux of the matter. But we will enjoy 10 minutes of musical interlude from the MOH choir. Thank you very much, MOH Choir. We have also been joined by the Acting Director of NHIE, representing the CEO of NHIE in the person of Dr. Abigail Dechi-Kwatin. If she's around, just give a wave. All right. Okay. That's fine. So now we'll invite the Director to begin the induction, the admission of fellows. We'll start with the Honorary Fellowship Award.
I'd like to invite Professor Matthias Richter-Tueter to please come up the stage and join me here. Thank you. Professor Matthias Richter-Tueter, the Ghana College of Physicians and Surgeons have observed your deep sense of love for the people of Ghana. Your first visit to Ghana on humanitarian medical aid mission, specifically to Accra Ridge Hospital, then now Greater Accra Regional Hospital, and subsequently to Komfo-Anokye Teaching Hospital, Kumasi in 1986, was the beginning of a very fruitful relationship which is still bearing fruit. You facilitated the postgraduate training of a number of Ghanaian doctors in the field of surgery in Germany by arranging hospital placement and work permit in your home province of Bavaria. You even accommodated and fed some of them in your home and personally trained them in the hospital where you worked in Munich. Indeed, you and your wife, Dr. Mrs. Marian Tueter, made your home a home away from home to Ghanaian doctors in Bavaria. It was a convergence center for them as you organized dinners, parties, and celebrated festivals together. Today, most of these doctors are fellows and trainers at various teaching sites of the Ghana College of Physicians and Surgeons in the field of general surgery, plastic surgery, urology, trauma, and orthopedic surgery. Professor Tueter, your vision at the inception of the Ghana College of Physicians and Surgeons to create a training relationship between the surgery faculty of Ghana College of Physicians and Surgeons and the German Surgical Society led to a day dedicated to Ghana, Christian Ghana Day, at the 2010 Annual Surgical Conference of the German Surgical Society in Munich, where 5 Ghanaian surgeons, all foundation fellows of the Ghana College of Physicians and Surgeons, were in attendance, making various presentations on the practice of surgery in Ghana. Even though you are retired from active practice, you continue to work to see the practice of surgery develop in Ghana. Since 2018, you have been the coordinator of a hospital partnership agreement between the Surgery Directorate of Komfo-Anokye Teaching Hospital and Klinikum Recht der ISA in Munich. An arrangement you lobbied the German government to sponsor, paving way for the exchange of visits between surgeons from Konfanochi Teaching Hospital and KRI in Munich. Over the years, you have leveraged your influence and contacts to mobilize and donate medical equipment to Ghanaian hospitals. Konfanochi Teaching Hospital was a beneficiary of 4 anesthesia machines and accessories valued at 100,000 euros to help manage COVID-19 patients during the recent pandemic. Professor Matthias Richter-Turter, for your selfless services and sacrifice to the people of Ghana, for your unwavering commitment to the development, training, and practice of surgery in Ghana, Ghana College of Physicians and Surgeons today, the 7th day of December 2022, confer on you an honorary fellowship award.
Okay, thank you very, very much. I'm very glad that the speech is held already, because my speeches in English are very bad. So, but anyhow, I want to state just 3 short points. The first is thank you very, very much. And I transmit these thanks also in the name of the German Association of Surgery and the German Association of Tropical Surgery. We are enjoying these both associations to work together with the colleagues who were trained in Germany and who all went back to Ghana to work here. The second is to make you understand, you heard already that my personal connections to Ghana by chance developed already 45 years ago. Many of you were not yet born at that time. Ghana has changed a lot since then, and I come back to Ghana every year with great, great pleasure. And the last point is that I want to encourage the young fellows who are now coming. You are the most important of all of our medical community. Don't let you discourage in your good beginner motivation of our wonderful profession. And especially, I must say, we must keep in mind as surgeons and also from other disciplines that over the half of our world population has no approach to reliable surgery or other disciplines. So we must continue to work and to fight to make health more just than it is now. Thank you.
Thank you. Now we'll move on to the induction of the fellows by election. By the authority of the Council, I present to you, College President, the following, who, possessing recognized postgraduate medical qualifications, have through professional competence, accomplishment and research, and on the recommendation of the relevant faculties and the academic board, have been elected for the award of Fellow of the Ghana College of Physicians and Surgeons. They are, for the physicians, Faculty of Internal Medicine, Dr. Abba Ankumaba Folsom. Dr. Cecilia Kutinsao. Dr. Henrietta Fishen. Dr. Jane Sandra Afriye-Mensah. Dr. Yao Edubuachi. Faculty of Laboratory Medicine, Professor Edmond Munir Der. Dr. Ernest Kwesi-Adjei. Dr. Frederick Kwame Hobenu. Faculty of Pediatrics and Child Health, Dr. Emmanuel Okain. Dr. Kwabna Ajepong Osman. Dr. Margaret Niza. Faculty of Public Health, Dr. Nana Aigua Hagen Seniaja. For the Division of Surgeons, Faculty of Orthopedic and Trauma Surgery, Dr. John Abanga Alatiga. Dr. Raphael Kwoti. Dr. Richard Ogimabedu. Faculty of Surgery and Subspecialties, Dr. Kwesi Ajin-Mensah. Dr. Anthony Pelamina. Dr. Ebikile Ivibedu. Dr. Edem Kofi Anyigwa. Dr. Emmanuel Yaovoado. Dr. Frank Nketiabuachi. Dr. George Kojo Wepeba. Dr. Jerome Kwesi Boate. Dr. Joachim Kweku Amwaku. Dr. Kafui Kokutamaklo. Dr. Kojo Ntiamwa Ampedu. Dr. Kwesi Okumeni Nsafo. Dr. Lily Pinchowu. Dr. Maoli Kwame Ametepe. Dr. Patrick Ekobanka. Dr. Seth Ajay Ajete. And Dr. Teddy Chiate Totime.
by the authority vested in me as the President of the Ghana College of Physicians and Surgeons, I confer on you the fellowship of the college in your specialties with all the privileges and responsibilities. Congratulations.
Now I'm going to administer the college pledge, so please say after me. I, upon my honor, pledge to faithfully observe and obey the laws and regulations of the Ghana College of Physicians and Surgeons. I pledge to promote the highest ethical practice and professionalism. I pledge to constantly upgrade my knowledge and skill and pass these on to future generations through teaching of students and health professionals. I pledge to promote the general health of society through advocacy. Through this pledge, I promise to maintain and faithfully defend the honor, dignity, and good name of the Ghana College of Physicians and Surgeons. So help me God. So you can now put on your Tudor hats and let's applaud them. The graduating members, applaud them loudly. This is what you're aspiring to be. So please, you can sit, take your seats now, right? Now we move on to the fellows by examination. By the authority of the council, I present to you, college president, the following who have undergone senior residency training in an accredited institution and have also passed the examinations prescribed by the respective faculties. You may please confer on them the award of Fellow of the Ghana College of Physicians and Surgeons. Division of Physicians, Faculty of Internal Medicine, Dr. Abdul Subur Yakubu. Dr. Bright Opong. Dr. Frederick Akoto Asumeni. Dr. Seth Yao Nani. Faculty of Pediatrics and Child Health, Dr. Koku Hefume Ameganho. Faculty of Public Health, Dr. Andrews Eyim. Dr. Emmanuel Senyo Kasu. Division of Surgeons, Faculty of Dental Surgery and Subspecialties, Dr. Alfred Nyaku. Faculty of Ophthalmology, Dr. Akosua Bedu Mensabunsu. Dr. Akwesia Jiman Ahmed. Dr. Angelina Ampong. Dr. Bile Kwe. Dr. Vera Mausimebeyu. Faculty of Orthopedic and Trauma Surgery, Dr. Jiwonu Kunucho. Dr. Senyo Gudugbe. Dr. Madonna Lawson. Dr. Michael Leat. Dr. William Jao Juamina. Faculty of Surgery and Subspecialties, Dr. Anita Esinam Agbeku. Dr. Frank Enoch Jemfi. Dr. Kingsley Bosumpim. Dr. Nelson Aguado. Dr. Farida Ajay. Dr. Abdul Jalilu Muhammad. And Dr. Yao Amwa.
By the authority vested in me as the President of the Ghana College of Physicians and Surgeons, I confer on you the fellowship of the college in your specialties with all the privileges and responsibilities. Congratulations.
So please say after me the college pledge. I, upon my honor, pledge to faithfully observe and obey the laws and regulations of the Ghana College of Physicians and Surgeons. I pledge to promote the highest ethical practice and professionalism. I pledge to constantly upgrade my knowledge and skill and pass these on to future generations through teaching of students and health professionals. I pledge to promote the general health of society through advocacy. Through this pledge, I promise to maintain and faithfully defend the honor, dignity, and good name of the Ghana College of Physicians and Surgeons. So help me God. let's put on your Tudor bonnet.
Mr. College President, by the authority of the Council, I present to you these specialists who have undergone postgraduate residency training in various accredited institutions and have also passed the examinations prescribed by their respective faculties. You may please confer on them member of the Ghana College in the following specialties. Faculty of Internal Medicine, Dr. Daniel Amewonu, Dr. David Eko Aku, Dr. Diana Mensah, Dr. Edward Donko, Dr. Florence Koyo Akumia, Dr. Louise Avoklia, Dr. Mark Kwabla Kekeshi, Dr. Nanaya Chefimpong, Dr. Obing Fojo, Dr. Penyin Benyima Aveme, Dr. Sefako Julien Fiajo, Dr. Suave Sulemana, Dr. Victor Eko Edwam Ekem, Dr. Wilhelmina A.C. Enin, Dr. Yakubu Abukari Natogma. The Faculty of Internal Medicine. So next, Faculty of Laboratory Medicine, Dr. Augustine Boachi Donko, Dr. Edith Yeboadria, Dr. Elikem Kumaho, Dr. Ivy Marie Agui, Dr. Raphael Luguzuri, Dr. Veneranda Nyaku, Faculty of Pediatrics and Child Health, Dr. Abdul Wahab Salab, Dr. Annie Maunyo Owusu, Dr. Christina Cheramanting, Dr. Cynthia Senam Amedo, Dr. Ernestina Ada, Dr. Frank Nilante Sunkwa Mills, Dr. Hannah Sharon Mills, Dr. Josephine Oduro Trinipua, Dr. Joyce Nana Agri Ejutrum, Dr. Judith Ayamga, Dr. Mami Ama Fowa Sego, Dr. Nana Akwesi Ajiman Ababio, Dr. Nana Anyimedura Anani Bimfo, Dr. Neda Ayibisa, Dr. Patience Okaikai Okante, Dr. Priscilla Alassam, Dr. Samira Ulimi Ananga Yamyolia, Dr. Selom Kwashi Chakasu. So that is pediatrics. Faculty of Public Health, Dr. Alex Ansawusu, Dr. Barikusu Abukari Seidu, Dr. Betha Adra Joe, Dr. Hectoria Awikea, Dr. Ibrahim Akwesi Asantimeno, Dr. Kilian Akwesi Bwampong Kanam, Dr. Kwame Yeboah, Dr. Louisa Ademki Mate, Dr. Momodu Cham, Dr. Ransford Paul Selassie Sefenu, Dr. Richard Ni Ama, Dr. Shirley Lily Ama Newman, Dr. Yao Trufo Safo. Mr. President, your members.
By the authority vested in me as the President of the Ghana College of Physicians and Surgeons, I confer on you the membership of the college in your specialties with all the privileges and responsibilities. Congratulations.
Please say after me, I, upon my honor, pledge to faithfully observe and obey the laws and regulations of the Ghana College of Physicians and Surgeons. I pledge to promote the highest ethical practice and professionalism. I pledge to constantly upgrade my knowledge and skill and pass these on to future generations through teaching of students and health professionals. I pledge to promote the general health of society through advocacy. Through this pledge, I promise to maintain and faithfully defend the honor, dignity, and good name of the Ghana College of Physicians and Surgeons. So help me God. So you can put on your motorboards. Congratulations. You may be seated.
College President, by the authority of Council, I present to you these specialists who have undergone postgraduate residency training in various accredited institutions and have also passed the examinations prescribed by the respective faculties. You may please confer on them members of the Ghana College in the following specialties. They are Faculty of Dental Surgery, Dr. Amanda Amache Champong, Dr. Caroline Fishena Apa, Dr. Vidra Kwesimenu, Dr. Zizom Kwesiklu, Dr. Ernest Nyakuchum, Dr. Felix Ampufu Anafi,
Dr. Henry Kwesi Champong, Dr. Kojo Amachi Champong, Dr. Maria Ekuya Demanya Kong, Dr. Mary Jani, Dr. Nana Bodi Asare, Dr. Naziru Issa, Dr. Peter Buete Populampu, Dr. Sean Hidden Choi, and Faculty of Ophthalmology, Dr. Adakudugu Ida Mbamba, Dr. Dorothy Uforiado, Dr. Ednam Yawa Akude, Dr. Hubert Kwesi Kumsen, Dr. Isabella Perpetual Arthur, Dr. Junior Anko, Dr. Jocelyn Bowman Sanluri, Dr. Lawrence Opong Kusiapia, Dr. Michelle Dampin Chinebua, Dr. Nafisa Rita Mahama, Dr. Richard Emmanuel Enimel, Dr. Ya Kusiwa Ochiri, and for Faculty of Surgery, Dr. Agbenya Kobla-Lovi, Dr. Alassane Ebukari, Dr. Anthony Akubasi Avoka, Dr. Collins Efriye, Dr. Delari Akusia Gapito, Dr. Dennis Dari, Dr. Dominic Opoku, Dr. Dorcas Saki, Dr. Eden Dazoza, Dr. Emmanuel Kafui Ayodeji, Dr. Ephraim Texan, Dr. Eric Apodola, Dr. Haruna Idrisu, Dr. Jessica Dea Samoa, Dr. John Daleku, Dr. Joseph Ni Aite Hill, Dr. Joseph Ofori Amegache, Dr. Justine Dakura, Dr. Luke Adagra Aniako, Dr. Maniku Bernard Non Bavier, Dr. Maurice Kofi Dodunu, Dr. Michael Adifuche, Dr. Michael Kwaponya Kong, Dr. Osman Imoro, Dr. Paul Ejapong, Dr. Ruben Atupari Biana, Dr. Sarah Sugu Azindo, Dr. Sarah Kane Eduma, and last but not least, Dr. Temitope Ebenezer Akofu. Mr. President, your members.
By the authority vested in me as the President of the Ghana College of Physicians and Surgeons, I confer on you the membership of the college in your specialties with all the privileges and responsibilities. Congratulations.
So please say after me, I, upon my honor, pledge to faithfully observe and obey the laws and regulations of the Ghana College of Physicians and Surgeons. I pledge to promote the highest ethical practice and professionalism. I pledge to constantly upgrade my knowledge and skill and pass these on to future generations through the teaching of students and health professionals. I pledge to promote the general health of society through advocacy. Through this pledge, I promise to maintain and faithfully defend the honor, dignity, and good name of the Ghana College of Physicians and Surgeons. So help me God. So put on your motorboards and you can take. Congratulations, you may take your seats.
Congratulations to our new fellows and members. Before we receive the closing remarks from the council chair, we will invite the college president for an announcement.
College election results. We had the election of new officers of the college last week, and these are the results. Incoming college president, Professor Samuel Deborah. Incoming college vice president for the Division of Physicians, Dr. Justina Ansa. Incoming vice president, Division of Surgeons, Professor Pius Agbonoku. By the way, they are incoming. Induction of the new officers will be done at the dinner this evening, and they will take office on 1st January 2023. Thank you.
Thank you very much, College President. We will now invite the Council Chair, Professor Yao Edujemfi, for his closing remarks.
Hello. All I have to say is congratulations again. Now you're going to go out there and perform. And remember your pledge or the oath you swore to give to the community, give of your best, continue updating your knowledge, upholding all the ethical principles of our profession, and so on. It will take a lot, but in all humility, and if you let that guide you, consult, you will be all right. Now, I'd like to congratulate our German friend on all that he's done for us. We appreciate all of it, But like Oliver Twist, we will ask for more. On this note, by virtue of the authority vested in me as Chairman of Council of the College of Physicians and Surgeons, declare this assembly closed.
Thank you very much, Council Chair. We will have the vote of thanks from Dr. Ida D.
The Deputy Minister of Health, Alhaji Mahama Saini, representing the Minister of Health, Professor Chair and Chair of Council, Professor Yaudi Jenfi, President of the College, Dr. John Nkrumah Mills, the Rector, Professor Danu, and the Vice Chair, Faculty Chairs, past Rectors, Members of Council, Her Excellency Ms. Harriet Thompson, who has left us, the Honorable Deputy Minister and Attorney General and Minister of Justice, Honorable Diana Asunoba Dapa, distinguished representatives from the sister colleges, Professor Liss and Professor Parkins, all you great and famous men and women, our new and oldly inducted members and fellows, distinguished invited guests from all walks of life, members of the press, all protocols observed. We have once again been inspired about our brotherhood of duty. We live here inspired about the growth of the college, thankful for our teachers who are our parents and now part of our pocket money earners. Our valued collaborators and development partners, our Minister and Ministry of Health, who tell us that all we have to do is to clap for them. We, the chickens, to borrow from Professor Lix, are thankful for having survived the storms, making the best of what we have, and we continue to develop innovative and creative ways to train and provide excellent health care to our citizens. We are thankful for the family and supporters of the new generation of wise, brave, and strong young doctors who are leading the generation and growing the college. To the college, the organizing committee, and all the administrative staff, we thank you for a beautiful ceremony. Long live you, long live the Ghana College of Physicians, long live Ghana. Thank you.
Thank you very much, Dr. D. So we started with the opening prayer, and we will finish with the closing prayer from, once again, Dr. Okaiko Addison.
Shall we please rise for the closing prayer? Our Father and our God, we thank you so much that just as we asked you for, you have brought the ceremony to a successful end. We pray that as we leave here, you be with all of us and send us to our respective destinations and help us in all our endeavors. In Jesus' name we pray with thanksgiving. Amen.
Please take your seats for a few announcements before we depart. So, there will be photographs outside And when we get there, they will lead us as to how we'll go about doing the photographs. When the announcements are done, the high table will depart first, led by the mace bearer. They will be followed by council members. And then, after they have left, everybody else can leave in an orderly manner. After the photographs, all council members, all divisional chairs, and our guests from sister colleges should meet at the Fellows Lounge on the 3rd floor. And then there is a phone which has been found, and if your phone is missing, kindly contact James from the Education Office and identify it for collection. All right. So thank you very much. My name is Patrick Mason. It's been a pleasure to lead us through this session. We'll have another one in the afternoon. Thank you for your patience. So council will leave with the high table led by the mace bearer, and then we will all follow. Shall we please be upstanding as they depart? Congratulations, everyone. We can follow in an orderly manner. Please, there will be photographs outside.